Okay, well, welcome, Claire. Thank you for being my guest at the QMWS President's Chat. It's been a while that I've been wanting to have you as my guest. We first met at a Doctors Health conference where you spoke, and well, you and I both come from countries where occupational physicians is a specialty, or occupational health is a specialty that is well established. In Australia, it's much lesser known. I have to admit, when I came here, I expected there would be occupational physicians working in doctors' health, um, but there's not that many. Only know two. So I was hoping that you could maybe shed a bit of a light on what the specialty is here in Australia, and so our listeners can have a better idea of that.
Okay. So in Australia, training in occupational and environmental medicine is under the Faculty of Occupational and Environmental Medicine, which is a faculty of the RACP. So it's a physician specialty, but it's got its own little section. There's quite a lot of routes into the faculty, and we get a lot of people who are already hold GP fellowships who come and train, and then people from various other hospital specialties, some coming at quite junior levels and other joining much later in their career. Essentially, occupational environmental medicine in Australia is, and well, we cover Australia and New Zealand, is really sort of, I think, born out of heavy industry. It's come a lot out of people working in covering factories and mines. And so a lot of our development has been out of that sort of industry rather than similar organizations in, say, the UK, where I initially trained, where a lot of that training is done within the NHS in healthcare. So occupational environmental physicians are essentially experts in any way that health and work cross over, whether it's injuries that are caused at work and recovering from them, getting people back to work after an injury or an illness. We tend to be most well known in Australia and New Zealand in relation to workers' compensation and insurance medicine. But our training is very much in the preventive sort of beginning part of the story, where we're trying to keep people healthy at work, get people back into the workforce, have sustained sort of working lives for people, regardless of their, of their health, and whether we can get them working, even if they may have health issues. So I think there's a bit of a disconnect in how we're seen and what a lot of the work we do versus what we can do, and where sort of a lot of our value lies. And so I think that we also have that the environmental medicine bit that's sort of at the end that sometimes people forget about. Initially, it was just the Faculty of Occupational Medicine. The environmental was added on a bit later on, before my time. I'm not entirely sure it was before my time. But there's a lot of crossover in environmental medicine with public health, for example, or with other professions who deal with contaminated land. And whilst we're sort of trained in all aspects of environmental medicine, a lot of occupational and environmental physicians do focus on the industrial aspects of environmental medicine, because that crosses over into both sides of our training. So when perhaps people living near large industries may have worries about their health in terms of the environmental impact and the environmental health impact of occupational of settings. So it's really broad.
It's very broad, yes.
It's really
broad. Definitely.
And it's very it's very different to any other sort of training or any other part of medicine around the world, but certainly in Australia, it's done entirely in the private sector, or almost entirely in the private sector. And it's got that crossover of the commercial, that business interests, people running their own businesses, interacting with business. A lot of people working in sort of academic side of it. So there's it's really broad, and it's very different, I think, to any other training program or any other specialty that we have.
Yeah,
and I think that's why people find us difficult to understand sometimes.
So it's good we shed a light on it here. Yeah. No, because I don't know about, well, you mentioned the NHS. I know in the Netherlands, it's very much, it used to very much be in the public health sector, and now it's starting to be more in the private health as well. But in the Netherlands, we don't have a very developed private health system in that respect. I remember doing an internship in occupational health, which was I loved it. It was really good, and ever since I started working in burnout and burnout prevention, I've actually been asked to speak a couple of times on the annual occupational physicians conference in the Netherlands. So burnout and lifestyle medicine seems to be like two big topics that are being embraced by the occupational physicians that I know. Is that something that's happening here as well in Australia?
I think in certain cohorts it is. I think we have doctors who are definitely interested in that very holistic approach to workplace health. And I think lifestyle medicine really sort of lends itself to that, to being involved in that but I think we also have, because we're quite excluded from the public health system in Australia, we're not as involved in the sort of burnout prevention as I feel we could and should be. You see there's a lot of meetings and discussions, there's committees all about workplace well-being.
Yeah.
And none of them include an expert on occupational health.
Yeah, exactly.
Which to me is like having a discussion about heart attacks and not including a cardiologist.
Yeah.
Obviously, a lot of people can come at it. We've got a lot of people with expertise. Well, we've got a lot of people with interests and other expertise that's sort of coming into that well-being space. But I think it's really important that we remember that well-being is part of overall occupational health. You can't have well-being without health and safety.
Yeah.
And we talk a lot about psychological safety at work and psychosocial hazards at work, as well as the physical aspects. And that all meshes in with the understanding of the organization and how the organization is run and work demands and job design. And there isn't a specialty that covers those things except for occupational medicine. And so I think we're missing out on a lot of expertise that is already available. And we're getting a lot of our information from people who have sort of expertise in a bit of it.
Yeah.
And trying to piece them together, but without that overarching occupational medicine expertise that I think is, but it's very difficult because a lot of these things are organized from within, and there's no funding for additional positions outside of what they already have. And when you do talk to organizations about occupational health, they often again go down that line of workplace injuries, work cover, insurance, independent assessment, which is part of it. But we're forgetting trying to prevent it happening in the first place, which I think is where our value hasn't really been realized as of yet. And I think it is being realized in other industries. There's a lot of occupational physicians working in large industries like mining, like construction, aviation, big industries with high risk work, where they see the value in our expertise, but we haven't quite got that into health yet.
Yeah, which is a shame. And I mean, especially with the regulations that have changed over the years, and there's such a focus on well-being in the workplace, and also the demands on the employer in this case. Have you found any changes in how occupational physicians work or being engaged after these regulations changed?
Not in health. I think there's obviously, I mean, occupational health is a very multidisciplinary sort of area, and people maybe don't always see the value of all the bit moving parts. So I think what happened with, and it's important, so the regulations have always been there. The employer has always had a responsibility to prevent harm. It's just been more explicitly labeled that psychological harm is included in that. It's always been included. It's just they're trying to get the words a bit more concrete. And health has always been, has always had those responsibilities. But I think what we're seeing, so as soon as the psychological aspect became the focus, a lot of organizational psychologists obviously have been engaged more. And then a lot of focus on well-being, often from interested non-experts. On the well-being side, obviously the organizational psychologists are experts. But on the well-being side, sort of enthusiastic people, but without specific expertise in occupational health or well-being. Whereas I haven't really noticed much demand or enthusiasm to get occupational physicians involved in that space in healthcare. Again, in high-risk industries, healthcare is a high-risk industry, but they don't always see themselves as that. The risks are generally a bit harder to quantify. Than we don't tend to fall off big buildings or get crushed by machinery, which, you know, those high, or planes don't come down. So those types of high risk industries, they've always known and always understood their risk, and they've always been very proactive in managing it from the beginning. Whereas I think health has relied for a long time on people going over and above what would usually be expected of workers, and tolerating environments and tolerating things that may not be accepted in other industries. And so I think
more the personal part.
Yeah, and I think that becomes so much the norm that people are reluctant to sort of go back to the beginning and say, well, actually, you know, where can we change the work demands and design, and how can we prevent all of this from happening in the first place? And we're still looking very much at that end piece of trying to make things a bit better when it's all gone wrong.
Yeah. It reminds me of a discussion I recently had with Dr. Gillian Farmer about whether to call things health and well-being, or if it's safety. Safety is actually encompasses everything. So what does the training look like in Australia to become an occupational physician?
Okay, so as I said at the beginning, so the training is done through the Australasian Faculty of Occupational and Environmental Medicine, or AFOM, and it's quite different to other training programs in that it's done entirely in the private sector, or almost entirely. And by that, I don't mean the private health sector, I mean the private corporate commercial sector. So we have accredited training positions, but AFOM doesn't control who gets put in them. So you have to apply for jobs on the open market.
Yeah.
Same as you would apply for any other job in the country.
Mm-hmm.
It's
And is this before you are in the training program, or this is after you have been accepted into the program?
So in order to be accepted onto the training program, you have to be in an accredited position.
Okay. Yeah.
At the moment, there is a bit of change happening, and there's I'll talk about, but there's change. I haven't been given a date of when those changes will come through.
Mm-hmm.
At the moment, we have 3 different stages. So stage A is people who haven't got specific qualifications before, so they're not already a GP, or they haven't passed basic physician training, and there's a couple of other things that can allow you to skip stage A. But stage A is sort of our early basic training sections, but you have to be in an accredited position, and you have to find your own supervisor.
Okay.
And you have to be working in occupational medicine for at least 20 hours of any week.
Okay.
That bit is going to change to become sort of a full-time equivalent process, where you can still work part-time, but it doesn't count as full-time. But the finding your own supervisor is quite tricky, and that we get a lot of people who find that difficult, because if there's not one obviously attached to your job, then it really is a matter of cold calling and finding someone in the area, and it's entirely voluntary. So if you think of supervisors in hospital, in occupational medicine, we have no paid time to supervise registrars.
Okay.
So any time that we are supervising it is just time that's taken out of our paid work time. So
and are there any exams involved?
Yeah. So there's exams at the end of stage A. There's a multiple choice exam at the end of stage A. And at the end of stage B, which is our sort of main training sector, there is a written and clinical exam. So similar to other physician training, but it's not quite an exit exam. There is a period called stage C after the exams, but that's quite short. So stage B is sort of the bulk of our specialist training. And the exams, so the MCQ exam is very general, very broad, covers most of medicine, as you would expect from a sort of an entry-level basic training. And then our stage B exams are very specific to occupational medicine. They cover, obviously, all aspects of medicine. So it could be orthopedics, cardiology, neurology, rheumatology, any ology that you can think of, we need to understand and to be able to talk about, but also those aspects that are not seen in other specialties, about fitness for work, liaising with organizations, the legislative aspects, and the environmental medicine as well, which other than public health is not really covered in other specialties.
And where do you get that training?
So you get that training in your accredited positions. So the accredited positions are very broad, and in most cases, people may stay in them for all of their training. Some of the accredited positions have time limits on them if they're quite specific. So some training positions may be in a single industry, like in aviation, or it may be very broad, working for a commercial occupational medicine provider who does multiple industries and lots of different types of work. So they're quite different. If you're in a job, this is probably one thing that's unique to occupational medicine at the moment, is if you're in a job that you think provides good occupational medicine training, you can apply for it to be accredited. So it's quite an open process, so long as you meet the requirements in terms of supervision, in terms of the type of work you're doing, and the breadth of your experience, then training positions can be essentially created by organizations, and you can apply for that to be with the faculty. They are looking at implementing some changes. So it's one of the things we have to do as part of our training as a graduate diploma in occupational environmental safety or health and safety. And it has to cover certain aspects like occupational environmental health and safety law, environmental medicine, and some other aspects. The plan is that will probably be a prerequisite to joining the program. So you will have to have completed it already. So that would be quite a big change.
Yeah.
And also the plan is to get rid of stage A and have people enter at a slightly more senior level, make it a bit more of an advanced training program. And they may come out similarly out of general practice, out of physician training, out of other specialties, or just people with broad experience and looking for a way to channel it into something a bit different.
Yeah. And at the moment, there's no way to have a bit of a look or a feel for it by, I don't know, having an internship there, or as a medical student having a look around?
So to my knowledge, there's no internships that include occupational medicine. Monash Medical School does include a bit of occupational medicine, more due to some occupational medicine physicians who have worked at Monash for many years and have managed to get it into the curriculum, which I've been trying to do for a number of years up in Queensland, and it's not easy because those curriculums are very, very full. But I'm not aware of any junior sort of rotating positions where people would be allocated to it. There's a lot of people who work in occupational medicine for a bit without joining the training program, either to see whether they like it. That would be, again, just applying for a commercial job. And there's a lot of reasons why people may choose to do that. One, because it tends to be office hours. It's reasonably well paid compared to, or certainly equitable, if not more well paid than some of the junior doctor hospital jobs. And it allows a bit more flexibility than some of the shift working positions that people come out of. So there's a lot of reasons why people sort of may try it out.
But it's usually a bit later on.
Usually a bit later on, and it's just applying for a job in the open commercial market rather than having any rotation from a sort of a hospital type position. To give people
where do you find these adverts?
So, I mean, Seek and all the the generic job application. There's in most states. So in Queensland, there are several large occupational medicine corporate providers. And so most people who are looking would know who those organizations are and directly at whether they have any jobs. And they're often the ones that people will start with. Because they do.
You also have a bit more of a community around you.
More of a community. They do have more junior positions with a bit more support and supervision than some of the smaller. It would be unusual for somebody at junior level, for example, to take a job within an industry. So it tends to be in those corporate settings that we see our most.
And there you have supervisors as well.
Yes. If you're a trainee, often yes. If you're just applying for the job, there will be some clinical supervision, depending on your level. But if you're a bit more experienced and independent anyway, then it's a sort of a commercial industry, so you can work within your scope. In occupational medicine, same as you could in any community setting.
Wow, Claire, I could go on for another hour. As I said, we only keep it to 20 minutes. I would just like to know from you, what are your hopes for the future in occupational medicine?
I think my main hope for the future is for people in all industries, but for me particularly in health, to see the value of occupational medicine, both as a specialty, so that we can start getting into health as an organization and trying to improve the occupational health and well-being of staff members, but also to introduce occupational medicine and environment. I keep forgetting to say the environmental. I work primarily in occupational medicine, which is why I keep forgetting the environmental. But it is a key part, and some people work almost exclusively in environmental medicine. I think for me, I'm really passionate. I want it introduced at an earlier stage. I'd love to see it in medical schools. I would love to see people rotating into it. And people, my experience is that a lot of people end up in occupational medicine as a sort of a last resort, sort of that they don't go into it with a positive, I really want to do occupational medicine. They may end up there, they may end up loving it. But we often get people who are a bit burnt out with shift work, or a bit over the complexity of general practice and Medicare billing and all the other difficulties that GPs have. And they end up in occupational medicine for a variety of negative reasons, in that they're looking for something that doesn't have this and doesn't have that and doesn't have this. And I think I'd love to sell the positives a bit more, of that, get people in there because they want to be doing
and there's so much to do in prevention and early intervention. And
that way you get people who are more enthusiastic about the specialty, rather than, doing it because they ended up unhappy in somewhere else.
Yeah. Just sparks one last question for me. I'm thinking of climate change, of course, and this is very much, environmental medicine. Isn't there like a bright future ahead within climate change? Bit of a strange word to call it bright future, but
it probably will be brighter. I think there's a huge scope in occupational medicine, because it really is one of those areas, and environmental, where you can do what you want to do with the skill set that you end up with. And you're certainly seeing more out of America, who are very much going down that sort of climate medicine, environmental medicine, lifestyle medicine. They all seem to sort of all coincide. And a lot of occupational environmental physicians are heading into that space. I'm not seeing it as much in Australia yet, but I think we're quite an old specialty. If you look, I don't have the stats in front of me, but if you look at our stats compared to other specialties, we trend quite old. Even our trainees are a bit older than other trainees, because they've often come from different things. So I think as we're getting the younger cohorts through, we're getting people who are a little bit more idealistic and a little bit more looking for something a bit different, and how can they take that skill set and use it for all of those types and branches of medicine that will be really big and really important in the future. And so we are starting to see it. We've got our main our training numbers are sort of limited by our accredited positions, and also the numbers of supervisors. So it's we're kind of drip feeding it. Drip feeding them in at the moment. We're nowhere near the big sort of physician specialties in numbers, but we're trying to make up for it in there.
Well, and I tend to meet quite a lot of more early career colleagues that are very passionate about these topics. So maybe occupational medicine would be an idea where they can carve their own way a bit more themselves.
I think it is. It's much more self-directed and self-motivated than other specialties. The path is
which can be scary too.
The path is not clearly trodden. You really can make your own way in it. When people ask, like, what does an occupational environmental physician do? There is no answer, because you take 10 of us, and other than we have a bit of overlap, people often do a lot of assessment work, because that's where people are willing to pay us. And that's where people see our expertise. But people are really trying to get into the things that they're interested in, and the world's your oyster, really. If you persuade someone of your value, then you can do it.
But it would be up to yourself. Where are people able to get more information?
So most of the information about training is on the faculty website. So the Australasian Faculty of Occupational and Environmental Medicine, which is part of the RACP. And there's more of us around than you think, and most of us are fairly approachable. So I probably get 2 or 3 messages a month.
Oh, yeah?
Just sort of cold calling people who are just interested in finding out a bit more. And I think There is on the website, there is a training program director in every state, and you can find their contact details on the website. But most of us are fairly approachable as well. But it really is just it's a network of people. Other than the website, it really is just a network of people. And ANZOM, so that's the Australia and New Zealand Society of Occupational Medicine, is another good one to have a look at, which includes occupation, and they're very closely linked with AFOM, but it also includes people who are involved in occupational health but may not be occupational physicians. Yeah. So like GPs with a special interest, or people who are just interested in the specialty more broadly, and a lot of occupational health nurses. So that's another area where you can sort of find out what's going on without necessarily committing to training in the first instance.
Wow, Claire, thank you so much. I think I have to keep to the time here, but thank you so much.